Chapter 8, Alcohol Screencast 3. This screencast is focusing on the risks associated with the excessive consumption of alcohol. The excessive intake of alcohol contributes to 4 of the 10 leading causes of death in North America: heart failure, arrhythmias, some cancers, cirrhosis of the liver, motor vehicle and other types of accidents, and suicide. This figure here is more specifically demonstrating the impact that alcohol has on various organs of the body. The first is the brain, and unsurprisingly, there are significant cognitive deficits. These include difficulties with memory, learning, and problem solving. If we look at problems associated with skin, vasodilation and flushing of the skin, various types of cancer impacting the oral cavity, throat, larynx, and the esophagus. If we look at cardiac issues, things such as high blood pressure, damage to heart muscle, and heart failure due to the damaged muscle. Breast cancer. If we look at the stomach, irritation of the lining of the stomach known as gastritis, and stomach cancer. If we look at the liver, this is the organ we probably think of the most when we think about organs that are damaged by the intake of alcohol. This includes things such as fatty infiltration of the liver, alcoholic hepatitis, cirrhosis, liver failure, and also liver cancer. If we look at the pancreas, impaired pancreatic function, potentially resulting in low blood glucose and pancreatic cancer. Within the small intestine, the excessive use of alcohol impacts resulting in malabsorption of many nutrients. If we look at overall, abdominal fat deposition and accumulation of fluid, known as ascites, cancers of the colon and rectum, and also damage in bone mineral density and increased vulnerability to hip fracture and osteoporosis. The liver is the main organ for alcohol metabolism, so unsurprisingly, long-term alcohol abuse will result in liver damage. The first is known as fatty liver. This is first seen as a response of increased fat synthesis and the trapping of fat within the liver. This is something that greater than 90% of all heavy drinkers actually develop, but keep in mind that fatty liver is reversible with abstinence or when these individuals stop drinking. Alcoholic hepatitis. This is inflammation of the liver if consumption persists. Symptoms include but are not limited to nausea, poor appetite, vomiting, fever, pain, jaundice. This is a condition that is very much tied into liver damage, and what it is a yellow-orange coloration of the skin and whites of the eye. Cirrhosis is probably the thing that comes to mind first when we think about damage to organs of the body attributed to the excessive intake of alcohol. Cirrhosis is actually the loss of functioning hepatocytes as the synthesis of proteins decreases. Ascites, this is a fluid retention within the abdomen, so significant swelling. This is not a reversible condition and liver failure will develop. There is a 50% chance of death in 4 years. It is associated with a 10-year or longer consumption of daily alcohol consumption. It does vary based on individuals. A nutritious diet may help delay some of the complications that are associated with cirrhosis. Here we basically look at a healthy liver versus a liver diagnosed with cirrhosis. Here on the left, we can basically see all of the functioning hepatocytes, whereas on the right, you actually see the jaundiced skin, and you also see visible fibrosis and the inflammation of liver tissue, and also not as many hepatocytes in this figure.